Today's a great day for patients, for families, and for community health providers across New Jersey. That's because this week we secured more than $45.7 million in federal funding that will go to 19 of New Jersey's federally qualified community health centers. At a time when there is so much focus on what's wrong with healthcare, it's great to be celebrating what is right about it. Every year, 24 million people, that's nearly 1 in 14 Americans, visit a community health center, and that includes 500,000 New Jerseyans. But it wasn't always this way. As a member of the Senate Finance Committee, I was in the thick of the fight when we were passing health care reform back in 2010. 8 years later, I'm proud of the gains that the Affordable Care Act delivered to New Jersey. Between covering those who previously were uncovered with pre-existing conditions, keeping young people on their parents' health plans, expanding Medicaid, and creating the health insurance marketplace, we're now some 800,000 New Jerseyans are finally able to get covered. But today reminds us that the Affordable Care Act was about more than making health insurance more affordable. It was also about making our health care system more accessible, especially for low-income families, people of color, and underserved communities. That's why during the health care reform battle, expanding the reach of community health centers was one of my priorities. And I'm proud that when we passed the Affordable Care Act, it included provisions that I helped write for an unprecedented $11 billion in investment in community health centers. It also includes my provision to ensure that these health centers are treated fairly like any other health care provider. One of the major ways in which the revenue flow for a federally qualified health center takes place is that it can be paid and must be paid as the same rate as any other provider. And I think that was critically important to the continuing success of our federally qualified health centers. Upholding our commitment to quality, community-based care has never been an easy task, especially in today's hyper-partisan political environment. It's sad and silly that President Trump and the Republican Congress are in a relentless crusade to take coverage away from millions of families. They spent most of the time in this Congress, nearly 40 votes, trying to repeal the Affordable Care Act without any idea of how to replace it. It's millions of people in our country who have health insurance for the first time. 800,000 in New Jersey who have health insurance for the first time. Thousands more who previously were no longer having the ability to have insurance because they had a pre-existing condition, or they hit an illness that ultimately brought them to the cap on their insurance, the amount of coverage, and yet they were still ill and still needing help. And so we eliminated lifetime caps so that people could continue to get the health coverage they needed. We allowed young people until the age of 26 to stay on their parents' insurance as they found their way in life. We changed our health care system from one that was disease-based, when you only go to the doctor when you're sick, to one that is preventative, better in the quality of life for the individual, better for us collectively in our society in terms of what it costs, and so much more. It wasn't perfect, but it was a dramatic step forward. And so spending your time in the Congress of the United States 40 times to try to repeal the law without any idea of what you would offer instead is a remarkable set of, I think, negligent actions. And now we have an administration who is driving up the cost of health care by virtue of what they are doing to undermine the law. So instead of making the law better, instead of providing health insurance to more people, instead of improving the quality of delivery of services to people, we have a set of circumstances where the administration is trying to kill the law by having prices go higher and higher and higher. They won't, for essence, under the law, there's a cost-sharing agreement that ultimately provides insurance companies to keep stability in the market rate. The administration won't pay the industry that amount of money. That creates unpredictability, drives up the cost of the price. For the first time since the Affordable Care Act, 4 million people less have health insurance today than when the law started. because when there was the sign-up period and the open enrollment, the administration did nothing about letting people know that there was an opportunity to enroll. And insurance is about spreading the risk. The greater amount of people who are in a pool, the lower the price. The smaller the amount of people, the higher the price. Purposely, so that ultimately they can declare that Obamacare, as they derisively call it, would fail. So for much of the past year, in addition to all of those challenges, community health centers had to grapple with the great uncertainty as Republicans played political games with their funding. Apparently, my colleagues don't understand that when they pass $1 trillion corporate tax cut without paying for them, our community health centers are incapable of deficit spending. That's why this year I led the fight in the Senate to secure a combined $7.8 billion in community health center funding in the Bipartisan Budget Act for fiscal years 2018 and 19, as well as another $1.6 billion in the recent omnibus legislation. So whether it's funding community health centers or extending the Children's Health Insurance Program, my law that we had to fight for, you would think that children's health is something that is bipartisan. Children don't know about Democrats or Republicans or independents. They only know that when they're sick, they need health care. And ultimately, we could not get the Children's Health Insurance Program renewed in time. It lapsed. And then they would only renew it for 5 years. And it's because we stood up and said, no, we're not going to vote for something that is less than a decade, which the Congressional Budget Office tells us actually saves us money. My legislation to extend children's health care became law for a decade. These are the things that make a difference in people's lives. Or investing in maternal health home visiting programs that have proven outcomes, which is another part of the law that I helped write. These hard-won efforts remind us that the fight to provide affordable health care to every American is an ongoing battle. Make no mistake, while the news media is laser-focused on the Russia investigation every term, or President Trump's every tweet, the administration is doing everything it can behind the scenes to hike insurance premiums and take coverage away from those who need it the most. Put simply, the administration is making America's health care system worse, not better. When every New Jerseyan I meet says that we should be focused on making it much better. That's why I plan to spend the rest of 2018 meeting with providers, with patients, and health experts across New Jersey to discuss how we build, not backslide on our progress. Make no mistake, I'm proud of what the Affordable Care Act achieved, but I won't be satisfied until we reach the day when every American has access to affordable health care universally, no matter where they live, how much money they make, or what kind of health challenges they face. Of the 500,000 New Jerseyans who visit a community health center each year, more than 3/4 come from minority communities or families that just live a paycheck away from poverty. So I'm convinced that expanding the capacity of our community health centers is one of the largest pieces in this puzzle. We provide some of the most cost-effective quality care in our country. Every time someone is able to avoid an expensive trip to an emergency room and instead visit a community health center, we save money, we improve lives, we help families. For taxpayers, for families, and for our health system as a whole, this is, as I call it in my operation, a no-brainer. Whether it's providing women with annual exams and access to low-cost birth control, providing dental care to our children, or treating mental illness and addiction. I know this $45 million infusion will be well spent here in New Jersey, because at a time when President Trump is working to lock millions of Americans out of our health system, I believe that community health centers are the key to building healthier communities. Because when we invest in our community health centers, when we turn that key, we unlock greater financial security, greater opportunity, and greater prosperity for all Americans. That's why, as New Jersey's senior senator, I will always be your champion and your partner in the fight to provide every New Jerseyan with the health care they deserve. And you are a big part of making that happen. Thank you for what you do here each and every day. Now,